This is my IM injection, which is intramuscular injections video. So the first thing that we're going to do before we give an IM injection is we're going to go ahead and check your MAR twice before entering the patient's room. So you're checking the MAR against the provider's orders. You are also checking the expiration date. You do not want to give a medication that is expired to a patient. You also don't want to give the wrong medication to a patient, and you don't want to give the medication to the wrong patient. So you always want to double check your work. And then you'll go ahead and enter into the room, and you are going to advise the patient that you're the nurse and that you're here to give them an injection. You want to go ahead and identify 2 patient identifiers. So verbally ask the patient, what is your name and date of birth? While you're doing that, check their wristband. You can also ask them, do you have any allergies to any drugs, anything like that? Make sure they don't have any, and if they do, make sure you know what they are. And then you want to go ahead and check your MAR for the 3rd time at the patient's bedside. Again, we don't want to give the wrong injection to the wrong patient. So always make sure that you check the MAR 3 times before giving that injection. While you're in there, you're doing an injection. So check to see where the last injection site was given, so you don't continually give the injection in the same spot. Once you are done with that, you can go ahead and advise. So you want to go ahead and hand hygiene and glove up. While you're doing this, you want to advise the patient what you're doing, and what the medication is and what it's for. So an example would be, I'm going to give you the flu shot. It's to prevent the flu, and it's because you're in the hospital and your immune system's already lowered. We don't want you to get the flu on top of what you already have. It's another complication. So you're giving them all of this information while also telling them, what are these, what the adverse reactions are. So, I can give you this injection. You might, one of the adverse reactions is inflammation, swelling, pain at the injection site. You want to give them a chance to ask any questions, as well as, reject the drug. Some patients don't want the flu shot. They don't believe in it. Some patients already had the flu shot and didn't tell you beforehand, but they're telling you now, things like that. So they always have the right to reject the drug. So after that, you want to go ahead and assist the patient in a spot that they will be easiest to inject. So we're going to go ahead and help the patient into a side position, because we're going to inject their ventral gluteal muscle. There's 3 sites that you can inject for an intramuscular injection. That's the deltoid, which most people are aware of, the deltoid right here. Most people get their flu shots, their pneumonia shots, their shingle shots, all in the deltoid. But the best place for an intramuscular injection is actually that ventral gluteal muscle, which is the hip. You can also, there's a 3rd spot to get that injection, and it's the vastus lateralis, which is, I guess I can show you on mine since my elephant, but it's this muscle right here. Again, we check the MAR to make sure that the last injection was not given here, so we can go ahead and give it, but we want to palpate beforehand. So we are palpating the integrity of the muscle. We're making sure there's no tenderness, there's no hard masses, there's no bruising, swelling, inflammation, edema. We want to check for all of that. If the patient has any of those things, you're going to choose a new injection site. You're not injecting in that site. But our patient looks pretty healthy here, so we're going to go ahead and inject him. So we want to go ahead, since we palpated him, we want to go ahead and just disregard these gloves. We want to put new fresh gloves on. So I would take these off, put new ones on, and then in order to find the injection site, it's a little difficult. So you want to put the heel of your hand on the greater trochanter of the muscle. So once you have that, you can move the 3 fingers away towards the back, and you can go ahead and put your thumb towards the groin. The purpose of this is to make a shape like this. My fingers don't like to do it. But this is what your hand should look like on the patient's hip, so that right in here is where your injection will go. So once you find that spot, you can, a little phlebotomy trick is taking the wipe and using it as a pointer so that you know where to inject. So you're just kind of leaving it on the patient, so it points to where, hey, this is where you're supposed to inject. You can also use anatomical landmarks. So if the patient has a mole that's somewhere close to your injection site, that's an anatomical landmark. Note that so that you know where you're injecting. Because you obviously, once you clean the patient, don't want to touch them in the injection site. So the way that you clean a patient is taking your wipe, starting at the injection site, going in a circular outward motion, and cleaning about 2 inches outward. Once you do that, you are going to go ahead and take your needle, get your needle ready. So you would just pull off the tip of it, and you're holding it like a dart in between your forefinger and your thumb. And these injections are supposed to go pretty slow, so about 1 milliliter per 10 seconds. If you have a patient who is an elderly patient and just doesn't have a lot of muscle mass, you're gonna wanna go ahead and make that skin fold, pinching the patient's skin a little bit, bringing that muscle up, and you can go ahead and inject it. But our patient looks pretty well, they have a good muscle mass, we're not going to make that pinch. We're just going to hold the patient's skin tight. We're going to go in a 90-degree angle. And again, it's going to go slow. So you're going to go in. Once you're in, you want to aspirate it to make sure that you're actually in that muscle. So you're in, you can go ahead and lift up on the tube. If you draw blood, you're not in the muscle. You're going to want to disregard this in the sharps container, start over. But for this purpose, we're leaving so we're in, we are not moving our non-dominant hand, it is a stabilizer for us. And then you're going to just go up, again pull down slow on that plunger, and then you're going to want to wait about 10 seconds before you pull it out. So you pull it out, you safety your needle, always safety your needle, put it down, grab a gauze. You're applying gentle pressure, you're not massaging the area at all. You're going to want to hold it for a couple of seconds, and then check to see if there's any blood. If there is blood, go ahead and give the patient a Band-Aid. If not, they're good. Go ahead and dispose of your needle in a sharps container and put the rest of the stuff in a trash can. You want to go ahead and flip your patient back over into a more comfortable position for them. And then you want to disregard your gloves and perform hand hygiene. You're trying to stay with the patient for a couple of minutes because you want to make sure that they don't have an allergic reaction to the injection that you just gave them. So go ahead and document everything. Document the medication you gave the patient, document the dose that you gave them, and document the site that you gave the injection in. And then again, stay with them a couple more minutes, make sure they don't have any of those allergic reactions. And then last but not least, you want to advise the patient again, tell them, remember those adverse reactions we talked about in the before I gave you the injection. If you experience any of those, call me immediately. If not, I'll be back in about 15 to 30 minutes just to check your injection site. So when you do come back, check that injection site. You're checking for any of those adverse reactions, inflammation, pain, swelling, and you're documenting those. But you just want to make the patient aware of everything that you're doing pretty much.